Welcome to the clinical skills video for the intramuscular injection. Prior to performing this procedure, you must ensure that you have explained to the patient what you are about to deliver and that you have confirmed the patient's identity. Also inquiring about any history of any adverse reactions or allergies. You must ensure that you then wash your hands thoroughly using the 11-stage approach. You must assemble your equipment. If a pre-filled syringe is being used, then that may be appropriate. If not, we need appropriate sized needle, syringe, gauze swabs, sharp spin, and the drug being administered. For IM injection, we can use either a 21 gauge, which is a green needle, or a 23 gauge, which is a blue needle. The size of needle would be dependent on the patient's muscle bulk, position, size, age of the patient, as to how big they are, as to what size you will need. You then need to decide the injection site that you are going for. You must check the prescription chart to ensure that the appropriate drug has been prescribed. You must check that you have the right patient, right drug, right dose, right route, and right time. Dispose of this drawing up needle prior to attaching the needle that you will use to administer the drug to the patient. Be a blue or a green needle. In this case, we'll use a blue needle. You must then prime the needle prior to administering the drug. Ensure you have all your equipment ready prior to proceeding with this injection. In this example, we will be using the upper arm or deltoid muscle. There is no need to cleanse the skin unless the area is not socially clean, but make sure you avoid any areas of infection or lesions. You must then stretch the skin using the Z technique. Stretch it with your non-dominant hand. Verbally prepare your patient prior to inserting the needle, and insert the needle at about 90 degrees, leaving about 1/3 of the needle out of the skin. Prior to injecting the drug, you must withdraw slightly to ensure that you have not hit a vessel, and then inject the drug to the patient. Once the whole drug has been administered, withdraw the needle safely, close the needle safety device if using, and dispose of the needle in the sharp spin. Apply gauze and pressure to the site, and check for any bruising or bleeding. Ensure that the patient is comfortable, explain to them any adverse reactions and any aftercare advice they may need, and ensure that the procedure is documented on the drug administration chart and the patient record appropriately. In summary, for this procedure, you need to confirm your patient's identity, ensure the patient has no known allergies and the procedure is fully explained. Wash your hands, assemble and prepare all equipment and drugs ensuring the aseptic non-touch technique. Use the Z technique, inserting the needle at 90 degrees and leaving 1/3 of the needle out of the skin, remembering to clean the skin first if it's not socially clean. Ensure that all darts are disposed of safely, ensure that adequate aftercare advice is given and that the correct documentation is filled out.